Prevention. See also 2019-20 Coronavirus Pandemic section. Prevention. An illustration of the effect of spreading out infections over a long period of time, known as flattening the curve. Decreasing peaks allows healthcare services to better manage the same volume of people, and allows for more preparation time. Alternatives to flattening the curve. Because a vaccine against SARS-CoV-2 is not expected to become available until 2021 at the earliest, a key part of managing the COVID-19 pandemic is trying to decrease the epidemic peak, known as flattening the epidemic curve, through various measures seeking to reduce the rate of new infections. Slowing the infection rate helps decrease the risk of health services being overwhelmed, allowing for better treatment of current cases, and provides more time for a vaccine and treatment to be developed. Preventive measures to reduce the chances of infection in locations with an outbreak of the disease are similar to those published for other coronaviruses. Stay home, avoid travel and public activities, wash hands with soap and warm water often and for at least 20 seconds, proper hand hygiene, practice good respiratory hygiene and avoid touching the eyes, nose, or mouth with unwashed hands. The CDC recommends covering up the mouth and nose with a tissue during any cough or sneeze and coughing or sneezing into the inside of the elbow if no tissue is available. They also recommend proper hand hygiene after any cough or sneeze. Social distancing strategies aim to reduce contact of infected persons with large groups by closing schools and workplaces, restricting travel, and canceling mass gatherings. According to the WHO, the use of masks is only recommended if a person is coughing or sneezing or when one is taking care of someone with a suspected infection. To prevent transmission of the virus, the Centers for Disease Control and Prevention (CDC) in the United States recommends that infected individuals stay home except to get medical care, call ahead before visiting a healthcare provider, wear a face mask when exposed to an individual or location of a suspected infection, cover coughs and sneezes with a tissue, regularly wash hands with soap and water and avoid sharing personal household items. CDC also recommends that individuals wash hands often with soap and water for at least 20 seconds, especially after going to the toilet or when hands are visibly dirty, before eating and after blowing one's nose, coughing, or sneezing. It further recommended using an alcohol-based hand sanitizer with at least 60% alcohol, but only when soap and water are not readily available. For remote areas where commercial hand sanitizers are not readily available, WHO suggested 2 formulations for the local production. In both of these formulations, the antimicrobial activity of ethanol or isopropanol is enhanced by low concentration of hydrogen peroxide while glycerol acts as a humectant 82. The WHO advises individuals to avoid touching the eyes, nose, or mouth with unwashed hands. Spitting in public places also should be avoided.